gentlemen, and my dear colleagues. I am Dr. Majid Paracha. I am working as the Associate Professor in the Department of Dermatology, Lady Reading Hospital, Peshawar. Today, the topic of my discussion is efficacy and safety of methotrexate in chronic actinic dermatitis. It was a pilot study. Chronic actinic dermatitis is an idiopathic, photosensitive, chronic dermatosis, primarily induced by ultraviolet B and less frequently by ultraviolet A light. Chronic actinic dermatitis has a worldwide incidence, as can be reported in Asia, Africa, Europe, and America, with increased cases in summertime when sun exposure is greatest. Prevalence is 1 to 5 per 10,000. It affects all ages. The mean age of onset ranges between 36 to 63 years and is more common in outdoor workers. Diagnosis is based on clinical, histopathological, and photobiological features. Rarely it has tendency for erythroderma. As we all know that we are using topical sunblocks, sunscreens, and topical steroid along with oral steroid for the treatment of chronic actinic dermatitis. But what made me to do the study is that steroid-sparing agents including azathioprine and cyclosporine has been used to treat condition with variable results. Hence, there was a need for another effective and cheap therapeutic tool. Moreover, the cyclosporine and azathioprines are costly drugs. So I started to work on the methotrexate, and methotrexate has been used in difficult to treat cases dermatosis of chronic actinic dermatitis in combination with azathioprine. So this made me to use it alone. It is an antimetabolite and cause immunosuppression by inhibiting lymphocyte. It is cost effective, safe, with rapid onset of action and easy to monitor its side effect. And we are also using it each and every dermatosis. The rationale of this study is to validate the efficacy and safety of methotrexate in chronic actinic dermatitis. So the methodology approval was taken from the Ethical and Research Committee. Written and informed consent was also taken from every patient, and a detailed history including physical examination and laboratory investigations were carried out for every patient. As it was a pilot study, it was conducted at Department of Dermatology, Lady Reading Hospital, Peshawar. Duration was 6 months. It was started on 1st March 2017 and ended on 31st August 17. A total of 30 cases were included, and the sampling technique was non-probability sampling technique. Inclusion criteria: patients of any gender with age greater than 30 were included, and clinically and biopsy-proven cases of chronic actinic dermatitis were included. Pregnant and lactating women were excluded, and history of chronic active infections with sensitivity to methotrexate and patients who were on any drug likely to influence the eczema, they were excluded from the study. Liver or renal disease or any abnormal complete blood count. Treatment protocol was, as we are using it in psoriasis, that is initially a dose of 10 milligram per week was given with sun protecting measure, and physical sun blocks were advised. Dose of methotrexate was increased to 15 milligram per week if less than 20% of improvement was observed after 4 to 5 weeks with monitoring of side effects. The clinical severity was evaluated visually using erythema and duration using PASI score. And this reference was taken from Shahzana Naqash study, who also used the PASI as a treatment evaluation test. The follow-up was, as we are using it in methotrexate uses, that is first week to do the complete blood count and LFTs, and then monthly for 6 months. And the observer was same each time for each case. Response of the treatment was graded as excellent when the response was 75 to 100% and 50 to 74% as good response. 24 to 49 was fair, and below this was considered as poor response. And the end point of the study was clearance of the lesions. Analysis of data was done using SPSS version 20, and mean plus minus standard deviation was calculated for numerical variables like age and duration. Frequency and percentages were calculated for categorical variables like gender, and efficacy was stratified among age, gender, Fitzpatrick skin type, and durations of symptoms to see the effect modification. Now, coming to the results, total of 30 patients were taken, 27 males were there and 3 females. Mean age was 57.5 plus minus 9.91 years, and the 27 patients received 10 milligram of methotrexate and 3 patients received 15 milligram of methotrexate. Duration of disease in these patients were less than 1 year in 5 patients, 2 to 5 years in 11 patients, and 6 to 10 years in 8 patients, and greater than 10 years in 6 patients. 29 patients completed the study. 1 patient had tearing, LFTs, and GI symptoms, so he left the treatment. Regarding the results, 6 patients, that is 20%, show complete recovery. 13, that is 43%, show 50 to 70% of recovery, and the 7 patient, 23% show 25 to 49%. Among 6 patients with complete recovery, 4 patients received 10 milligram of methotrexate, and the 2 patients received 15 milligram of methotrexate. So this is the final, that the p-value was highly significant regarding the efficacy of methotrexate in chronic actinic dermatitis. It was 0.00, which denotes its high efficacy. So the conclusion was that methotrexate can be effective and useful drug in the management of chronic actinic dermatitis. It can provide a cure to chronic disabling condition at a very low cost. Limitations were that it was pilot study, and the further studies were required to further evaluate the efficacy in chronic actinic dermatitis, and also the randomized control trials with the effective drugs to know about its further efficacy. Thank you. If there is any questions, let me know. Yes, sir.
I am a very common user of methotrexate in chronic actinic dermatitis, atopic dermatitis, and all sorts of eczema, and I think it's a very useful drug.
Yes.
As it is useful in psoriasis, it's very useful in eczema. So I highly recommend it.
Sir, it was cited in the literature. No one used it in chronic actinic dermatitis. Only one study showed that it was used. हम use कर रहे हैं, लेकिन सर किसी ने proper को किया नहीं है. So I think it was the first step. Inshallah, we will follow it. Anyone else? Okay. Thank you, ji.